Local, late breaking. This is WBAL TV 11 News Sunday morning in HD.
Now is 7:16, and in this morning's medical alert, it has been quite a week for women's health and the recommended rules for mammograms and pap smears. The American College of Obstetricians and Gynecologists is recommending women under 21 do not need pap smears at all. Women in their 20s can get them every other year, and women over 30 with a history of normal pap smears can be screened every 3 years and stop when they're 65 or 70. And when it comes to breast cancer screenings, new recommendations from the U.S. Preventative Services Task Force said that women not at risk for breast cancer need not schedule their first mammogram until they turn 50, and then only need to be checked every 2 years. Well, that recommendation is a huge break from the American Cancer Society's long-standing position that women should get mammogram screenings starting at age 40. Well, for insight into all of this, joining us is Dr. Frederick Walker, director of the Breast Cancer Surgery Center of Maryland, which is in Harford County. You have 37 years of experience in this field. Let me first just ask you, what kind of week it has been for patients calling you and people stopping you? It's got to be crazy for you this week.
I think it's been confusing because they don't really understand the recommendations. The recommendations said that with now 30 years of experience, we have good data to show that very few women in the age group from 40 to 50 will get a breast cancer, approximately 1 in 1,500. The question is, could we do fewer mammograms and still find that woman? And the answer is an emphatic yes.
Okay.
There are 4 groups of women who will deserve to have mammograms. First, any woman with a symptom, like a lump. They certainly deserve a mammogram, and this is called a diagnostic and not a screening mammogram. We're going to get away from the shotgun approach of just taking every woman because of her age and ordering a mammogram and ordering it for those women who really need it. The second group of women have been tested and found to have a genetic mutation, which means they're going to have an 87% chance of getting breast cancer in their lifetime. They deserve mammograms even starting as early as 25. The third group are women who have an abnormal cell found on their HALO Pap Test. This is a new test that does a Pap test for the inside of the breast. We don't go inside to get the cells, we draw them to the outside. This is brand new, it's only been around 2 years, and there are only 5 places in the state of Maryland where this is performed: Cumberland, Columbia, Silver Spring, Annapolis, and at our center.
Wow,
and we've been doing it since about January. We've picked up a number of women that have the precursor to breast cancer, which never shows up on mammogram. And when we do find a cancer, it's usually 3 years before it ever shows up on the mammogram. The fourth group of women have had a statistical analysis based on the 6 simple questions that are called the Gale model. People can Google the Gale model and find out about it, or find it on our website.
Spell Gale for me.
G-A-I-L.
Okay, so it's spelled that way. Okay.
So if they find that they are at higher than the average risk, they deserve to have a mammogram. By applying these 4 criteria of risk stratification, we'll probably be able to cut the number of mammograms in that 1,500 down to about 500, and we will not miss that one woman that has a breast cancer.
You went through this beautifully, but I have to ask you this question because Howard Kurtz in the Washington Post wrote about this, and I thought he really nailed it the way he said it. He said, this battle comes down to the question, what if the patient involved is your mother? What if it's your sister or your daughter? Wouldn't you want her to have the cancer screening? So I asked that to you as a doctor.
And the answer is very much no, because it creates more problems for those women. This is a benefit for women. We're not going to miss that one woman with breast cancer, and we're going to eliminate not only the unnecessary mammograms, but the unnecessary surgery that follows from finding a shadow that most likely is benign. If we apply these 4 risk strategies, all women who need a mammogram will still get a mammogram.
I think you explained this wonderfully this morning. I'd like to have some more time for questions for you, but we're running out of time. But I really think you explained it very clearly. If people want more information, they can go where?
About the HALO Pap Test, there's a funny website called Pap Test for the Breast with no spaces.
Okay.
And they can actually see a woman having it done. It was on the doctor's show a few weeks ago.
Okay.
Our website is also BCSC-OFMD, Breast Cancer Surgery Center of Maryland. On that, they can calculate their Gale risk and they can also find out how to get a HALO Pap test.
Thank you so much. We appreciate this, and I'm sure you will continue to be stopped with questions, but you did a terrific job. Thank you so much. And don't go away. When we get back, get ready in no time when it's party time. Expert makeup tips. I know you're hanging out for this one. No, you look good.